Golly, those eyes are set to kill.
I asked you if you would raise the minimum wage. You said you would consider it.
Yeah.
And so my question for you is, now that you are going back to the White House, for these 19 states that voted for you, are you going to raise the federal
It's a very low
minimum wage?
number. I will agree. It's a very low number.
It's not a low number. In fact, the number is too high. The ideal number is 0. Anyone who says otherwise does not know what they're talking about.
Let me give you the downside, though.
Yeah.
In California, they raised it up to a very high number. And your restaurants are going out of business all over the place. The population is shrinking. It's had a very negative impact. But there is a level at which you could do it, absolutely. Yeah.
What is that level? Do you
I don't
think?
know. I mean, I really don't know.
Chat be like, $10, $10, at least $9. Do note, these are the same people who just finished hearing Trump say that raising minimum wage caused significant problems for California. Clearly, the solution to the problems caused by minimum wage is to raise it even higher.
Tell them to bring me my money.
What's that word for repeating stupid things and expecting non-stupid results? Oh, that's right, an idiot. Since when has minimum wage solved the problem that it was created to solve? The answer is never. You know what would happen if you completely remove minimum wage? Magically, there's a job for everyone. Not just one job, but multiple jobs for everyone.
I think that every solution for healthcare that's not single-payer systems is bad. Yeah, exactly. Can you explain single-payer for normies? Basically, your taxes are higher and the government gives you healthcare. That's what I think the solution is.
If that's your idea of a single payer, I don't see anything single about the entire American population. Those are literally millions of payers. The problem with socialized healthcare is that once you start it, it becomes nearly impossible to stop it. Just like welfare, people get addicted to it. They adjust their entire lives around it. Instead of having less welfare, you get more of it, which is one of the main reasons why many areas remain poor or have low income. If the government pays for everything, what's the point in finding a job?
Every solution that necessitates insurance is bad.
I agree that insurance should not exist. Insurance was the market's answer to certain things, but I don't think they would have existed if non-market forces never created an environment for insurance. Nevertheless, socialized healthcare necessitates health insurance. Why don't you therefore conclude that socialized healthcare is bad?
Because so think about it like this. Every dollar spent on healthcare that goes to a private company, a lot of that money is paid out in dividends and big CEO salaries and payouts to other people. So there's a lot of excess money that the company collects because it's a for-profit company. All of that excess money is being added to the total amount of healthcare cost an individual has. So if you remove the profit aspect of it, and it just simply existed to serve a function, then you would have lower costs because you would not have all of this extra money that needs to be made as profit. Just, it's so fucking obvious. Yeah, so public healthcare? Yeah. Yeah, absolutely. I think that you should have private healthcare as well. I don't think that it should be illegal to have private healthcare, but people should be able to rely on public healthcare.
Oh boy, you're gonna set me off on a rant here. You say it's obvious, but that's not what keeps premiums high. The only thing obvious about anything is that you're leaving out so many factors that keep premiums high. And I don't mean risk management. The argument regarding dividends, CEO payouts, etc. could be said about any company as to why their products or services are pricey. However, doing so would prove the argument false. Cost of healthcare is up for multiple reasons, and most of it has to do with government intervention. People took advantage of government-provided health insurance, and they continue to do so to this day. Not to mention, when government pays for paychecks of others, that introduces job security and increases interest in the field. As a result, you see an increase in input, everyone trying to be a doctor or nurse, with the output failing to keep up. Output is far more important than input. Worst of all, if government is the one giving you your paychecks, the government is now your boss and calls all the shots. That is way too much control for the government to have. Also, you need a license to become a doctor or a nurse, but you don't need a license to be an administrator for these things. So what you get is an increased interest in becoming an administrator. So more money goes to administration than the actual healthcare. You can forget about CEO payouts or dividends being an issue at this point. Then you have associations like the American Medical Association pushing for advances in medical care. While advances in medical care is not a bad thing, it is nevertheless expensive. The costs for covering these advancements need to come from somewhere. Then you have laws that force health insurance companies to cover costs that they otherwise wouldn't have. This necessarily places a minimum cost of risk on health insurance companies, which acts similar to how minimum wage affects the market. Not to mention that it makes it that much more difficult for health insurance companies to force or negotiate prices downward. Supply and demand also apply here. You think you're helping people by forcing health insurance companies to cough up money, but that is short-term thinking, that's not long-term. You also have companies covering for health insurance for their employees. You might think that's not a bad thing, but companies are able to write it off on their taxes, meaning companies would benefit more from expensive health insurance. For someone such as yourself who has worked for the government, you should know that government is extremely bad at managing things. You should also know that government has its own self-interest. You want self-interest to be removed from the private sector, but you forget about the self-interest of the public sector. But the issue isn't self-interest. The issue is lack of competition. If you were to remove the profit factor out of private health insurance, there would be no incentive to have private health insurance in the first place. Meanwhile, public health insurance has their own self-interest. Self-interest is what creates competition in the private sector. But who can compete with the government? Competition is the only thing that can help not only reduce the price of premiums, but also increase quality of care. Socializing healthcare would essentially remove all competition. While you specifically wouldn't have laws that make private health insurance illegal, you would make them think twice about entering the market in the first place, which would act like as if you did make it illegal for private health insurance to exist.
The people whose lives really get fucked up by healthcare are not the lower class or the upper class, it's the middle class. Because lower class people, and if you're really fucking broke, you just show up to the emergency room. That's what you do. Like, I had to take my mom to the emergency room probably 10 times. Every single time we'd get a bill, you know what we do with the bill? We'd throw it away. And then we go to the emergency room again, and we get another bill. That's it. And it would just keep happening.
That's not exclusive to the lower classes. Anyone can walk into the ER and walk out without paying. It's illegal to deny you healthcare if you walk into the ER. I mean, sure, your credit score will go down if you don't pay, but who really cares about that anyways? Especially if you refuse to identify yourself. But this is just another reason why healthcare costs are high. Sure, forcing hospitals to treat you sounds good, but when most people walk out without paying, prices go up.
But what I'm saying is that the real squeeze on people comes from people that make too much money to qualify for government assistance, and they make too little money to be able to afford private health care without it affecting their budget. Those are the people that are very negatively affected. It's the middle, I'd say like probably 50% of people. Probably maybe 70, 80% of people, really. So yeah, that's my experience at least.
You're not taking inflation into account. Once inflation causes problems for the lower class, they're forced to chase after higher forms of income. You know what happens when they achieve higher forms of income? They enter into a higher tax bracket. So if your argument is that the ones who get screwed over the most are in the middle class, then I guess everyone is screwed. And yet, that's irrelevant if you just walk into the ER, get treated, and then walk out without paying.
Somebody says free healthcare in Canada has issues too. What if I told you that we have issues with healthcare here? I used to think Canadian healthcare was really bad until I asked a few people, and then they all told me, like, no, it's fine. I've been there and it's okay. So I think that people having bad interactions is always true, but that's not something that's probably limited to Canada. And I know that, like, my mom had bad experiences with private healthcare here. Like, that's what happens no matter what.
For the sake of argument, let's assume for a moment that socialized healthcare hasn't negatively impacted certain countries. Just because it is currently working for them does not mean that it will work for us. But no one asks why it hasn't ruined them yet. Maybe they've only recently socialized their healthcare. Maybe their country is generally healthy and not much people require healthcare. Therefore, fewer visits to their doctors. Therefore, everything seems fine to them. Maybe government intervention is not running rampant in those countries. Maybe inflation isn't that big of an issue for them, and so they're able to deal with high taxes. Maybe they're the kind of people who think that the solution to big government is more government. People are generally short-sighted. They generally look at the short-term benefits rather than the long-term problems.
You did try to overturn.
I did dislike the fact that Obamacare necessitated you paying insurance. I thought it was a government overreach. When a person is legally compelled to pay a private company, I think that's disgusting. Yeah, like just straight up the mandate. Yeah, that's the main reason I didn't like it.
Well, that's ironic. Socializing healthcare means you'd be forced to pay for health insurance. The premiums would simply come in the form of a tax. If Obamacare was government overreach, imagine socialized healthcare. But remember when they charged you for Obamacare, but government also didn't force you to pay it? Anyone remember that? That being the case, where do you think the government got the money to pay for healthcare?
Ladies and gentlemen, presenting the undisputed, the undefeated heavyweight champion of the world.
Better.
I think that RFK, what they need to do whenever he gets in charge, assuming that happens, right? Big assume. But they need to make it to where you can't take electives in high school that replace physical education, and physical education is mandatory for everybody. Because the real issue, the reason why people need healthcare, they need more healthcare, it's because everybody's fat and they don't do anything.
I agree, you shouldn't be able to skip physical education. Hopefully, physical education strengthens their willpower. I just wish losing weight made people smarter.
I want to have better health care for less money. And there are ways of doing it, I believe. And I
have to take out the middlemen that are making money off of it for no fucking reason. I mean, I gotta say, Luigi was right with that. Healthcare insurance is a fucking scam. It shouldn't exist.
Yeah, no, replace the private sector middleman with the public sector middleman. Replace one so-called scam with another scam.
God damn it! You can't make this shit up!
Thing is, you need the private sector middleman to exist. Think of it this way. What would happen if doctors didn't require a license to practice medicine? Who's going to assure that they're qualified to practice medicine if not the middleman? The middleman here would be the hospitals. It's in the hospital's best interest to assure that their staff are qualified. If things are merely existing as a function, then who's the one assuring quality? It's not going to be the government because it has never been able to assure quality.
Okay, so let me take a step back. How do insurance companies make money? They make money by averaging against actuarial tables, which are basically degrees of risk. They look at somebody's age, they look at all of their demographics, and then they have a calculator for how much money this person will probably cost. So basically, when you have to add in people that are really big draws on that. So for example, you add in somebody who's disabled, right? Somebody has cerebral palsy, for example. This is going to massively increase the average. So if you have an average of people that are relatively healthy, you can afford to keep your premiums lower and maintain the same profit, right? And so, again, the profit you could say is the problem, but this is a for-profit company, so we're just going to assume that that's what's going to happen. And so what happens is that the insurance companies, what they do is they effectively try to take the people out of the system that would cost a lot of money. Because these are the people, the extremes that raise everybody else's costs up. And so that's what the insurance companies used to do. And then they became compelled to have to give them insurance anyway, which is how it should have been.
What's interesting about that statement is that there was no mention of corruption. He left no room for CEO payouts, dividends, etc. to drive prices up. We've already addressed why forcing these companies to do things is problematic. He even admits that before government forced them to cough up money, insurance companies were able to cut costs by denying claims. Which is to say, forcing them to not deny people necessarily made insurance more expensive. This is worse than short-term thinking, since the immediate effects are obvious. Perhaps the issue was never about making it affordable in the first place. Perhaps the real goal is to destroy America altogether.
So basically, they did this for a while. I don't know if they still are doing it, where basically they said that if you stole something of less of, I think it was $1,000, they weren't going to go after you.
That's just another example where the immediate effects of government policies are obvious. Of course, people are going to rob whatever they can that's under $1,000.
Insurance companies, fine. They just need regulation. In Europe, you have it, and they basically can't deny anything. Hospital deals with them directly. You never hear anything about it. It's just like utilities. Yeah, maybe that'd be a better solution. Yeah, sure.
I've already addressed why government intervention causes a lot of problems. It's a very short-sighted solution.